my kind of introduction, which is there. So basically, I'm Rohit Bhatia, and I found this company Beyond Imagination as a co-founder of this company, as a director of this company. So I've been into healthcare and retail marketing for a very long time, and I've been responsible for setting up some of the great giants like Big Bazaar, Pantaloons in entire India, and responsible from launching it with the PR activities, branding activities, then at a time moving to digital marketing when the biggest task in, you'll be laughing that at that time, the biggest task in digital marketing was to get likes on Facebook. Okay. So from there, you can understand what transition we have in a decade's time, right? So setting up retail, setting up Big Bazaar, then moving on to healthcare, understanding that what cost per acquisition is, and when we talk about e-commerce, how a cost per acquisition in mobile sector, selling a mobile versus selling healthcare versus selling a real estate, how it is differentiating and how the ticket size matters in all these industries. So then moved to healthcare, and after moving to healthcare, I worked for B.L. Kapoor Hospital, I worked for Venkateshwar Hospital, and I was responsible for setting up a team. We started as a one team member thing for BLK Hospital, and then moving the digital marketing into a 6 to 7 member team, and making it an entire vertical for digital marketing in an organization. So when I even remember when I was hired in the hospital, so I was questioning myself that what will I be doing as a digital marketer in a hospital? But today the question has totally changed, that what all things I cannot do is a question as a digital marketer in a healthcare setup. So setting that up, so I've done my master's from Strathclyde University, which is in Glasgow. And there also I work for Sky Entertainment. So Sky Entertainment is basically your alliance that Tata Sky has with Sky Entertainment. So I was responsible for launching the HD boxes, and also responsible for digitalization of all the channels through HD, plus making them online available. So that was the role. A bit responsible for medical tourism also, and responsible for making the brand visible on different online platforms, and making sure that in pull-based marketing, we are always there on top through search engine optimization, social media marketing, and AdWords. So that is a brief introduction about me. And I'm great and honored to be part of all the eminent panelists, and so happy to have this global webinar being Beyond Imagination. So now what we will be doing is I'll be introducing our panelists, and then we'll be moving to certain questions that we have. And after that, we'll be following the Q&A round. So just before I move to the panelists, I just introduce the organization. So Beyond Imagination is an organization which has 4 verticals. And as a founder, as a director of the company, I feel very proud of the name, definitely. And also the kind of activities that we are involved in. So we have the first wing, which is called the Digital World @Beyond Imagination, in which we are helping the major brands in their digital activities, in promoting the brand, in performance marketing, in making sure that all the activities and all the money spent is led to some or other results in terms of revenue. Because one thing that our panelists will be talking about also is that digital marketing is one aspect wherein what we have done is we are able to measure it. We are able to measure where every penny is being spent, every eyeball that we get. We know that from where that person is coming, where that user or audience and acquisition is happening. Okay. Our next company is BI Executive Search. So we are into healthcare, real estate, and multiple industry manpower hiring. And the manpower hiring, we are doing above manager and above level, all the healthcare setup hiring we are doing. We are also responsible for hiring the top-notch CXOs of the organization, and we make sure that we are providing the top team to the best of the organization. And the digital and the BI Executive Search Association has actually helped us in providing the right team of digital to eminent organizations. Then we also have vertical, which is magazine of lifestyle and fashion world, wherein we have certain people who are related to fashion industry associated with us, and we are doing the digital number one, and we are also you'll be seeing some webinars coming up from lifestyle industry. Uh, Last but not the least, as you know that videos have taken a totally different vertical altogether. You must be knowing that if we talk about Google Analytics, there was a time that people used to read a lot of content, but today, when we see the trends, what we follow is that people watch a lot of videos, and the content has actually become video centric. It's all the game of thumb. Where your thumb stops, that means you have a very good creative. That means you have the beautiful creative, and people will watch it. And also, you must be aware that it's all the game of 5 second game, wherein you have to capture the user and make sure that your campaign or your ad or your video is being watched by them. So we open this vertical wherein we are getting a very good response, and we are responsible for making very great videos. Thank you. And now I'm moving forward. So first, I would like to welcome Ms. Jasrita Dhir, who is head brand marketing and CSR for Fortis Healthcare. Welcome, Jasrita. Welcome again.
Thank you. Thank you.
And it's a very small paragraph to describe her, but because of time limit and everything, I will start with this small paragraph only, Jasrita. Okay.
Sure.
So Ms. Jasrita heads the brand marketing and CSR for Fortis Healthcare Group presently. And it's a big role because I myself has seen that how they are managed together, and CSR is a very big role that one has to play nowadays. And she has worked in service sector throughout, from hospitality to healthcare, and with a short stint in media sector throughout media sector. And cause-based marketing or purpose-led communication is very close to her heart. Her professional journey started as direct marketing executive with P&G, and then she moved to frontline sales at Radisson and the Oberoi unit. Marketing, communication, and public relation roles furthered her career graph at Max Healthcare, and finally, she transitioned to a brand marketing leadership position and at Fortis Healthcare. With an additional charge, like I said, in sales. She is credited with lending the brand a higher purpose throughout private biggest public awareness and sensitization campaign on organ donation, which we must have definitely seen that more to give campaign was done, which is okay. So now I will be moving on to the questions that we have, Jasrita. So Jasrita,
Sure.
I'll start with my first question. Some sectors are amenable to digital. How should sectors with a large physical presence and long purchase journey, for example, healthcare and real estate, etc., tap into digital media?
Right. Yeah. Yes. So, see, there is this recent McKinsey report, which was tabled in July 2020, which says that we've vaulted 5 years forward in our digital transformation journey, both on the consumer as well as on the brand side, in just a matter of 8 weeks. The study was commissioned during the time of the lockdown, and tabled in July. So sectors which have technically been a bit of a tech laggard, such as you mentioned, real estate, healthcare, government, legal, these kind of sectors are going to see the maximum digital adoption and transformation in this year, as they haven't seen perhaps in the last decade, and it won't be an over exaggeration. Now come to see of it that 90% of the property searches are happening online already. Okay, in the time of the pandemic, now if you think of buying a house or moving into a house, when people were in areas which were locked down or curfew, you would have a 3D tour. You would have a 3D visual tour of the place that you're planning to rent out or place that you're planning to move into. So all these 3D videos, canvas ads, 360-degree tours, all of these things as we speak are being utilized by the real estate sector, right? And 90% of their lead generation is happening on social media platforms, if we see, so they're very, very sort of active on those platforms. So that's as far as real estate is concerned. If we talk about government as a sector, because, certainly in India, we wouldn't have thought that our government would be very, very active on social media platforms. But again, go back to the time of the lockdown, and you'd remember, Rohit, that many state governments, because health in our country is a state subject, so you had to follow the advisory of every state government. Every state government, every chief minister was sending advisories, putting up advisories through Twitter. So Twitter was the go-to medium for everyone to look at what's coming from, let's say, the office of Uddhav Thackeray, or from in Punjab, in the worst affected areas, etc. Coming to healthcare, there are enough researches and data to suggest that about 77% of the consumers search for a doctor online before coming and booking an appointment. 77, that's a whopping number. And some bit of this, digital adoption and transformation, this had started, the wheels had started to churn and move even before COVID. What COVID has done has acted as a catalyst, and like we said, is vaulted it forward, right? So therefore today, healthcare networks are dealing with consumers, patients and potential patients, which are remarkably discerning, and they're demanding transparency and two-way communication from their healthcare providers. So if you look at healthcare providers, what are the 4 or 5 areas that I can quickly talk about before tossing it back to you? Most healthcare providers are producing a whole lot of video content. So video is being immensely used by the healthcare sector, whether it is to do with demos of, the new technology, or it is patient testimonials for word of mouth communication. So that's number one. Number two, all healthcare providers are engaging, using that for patient engagement, customer engagement, as we talk about, with both their patients as well as their potential patients through Facebook Lives, Instagram Lives, online communities, etc., communities for mums, birthing, etc., etc. So all those cohorts that we talk about, and lookalike audiences. So that's what healthcare is already doing. The third category is healthcare is also, networks are also trying to ensure healthcare compliance through whether it's a pill reminder, or it's an ovulation reminder, or it is your health check reminders, etc. So, that health compliance sort of is also being done, through them. The fourth is the use of AI. During the time, you would have seen Apollo, you would have seen Fortis, you would have seen actually all large groups put up some COVID screeners, screening chatbots on their website or in the facilities, etc., which A, helped in contact tracing, and B, helped in mitigating the risk of infection to both the healthcare workers as well as the patients. And last but not the least, again, if you look at big healthcare chains, networks, you would see that pre-pandemic, now if you look at it, about 20 to 25% of the pre-pandemic OPD volumes are being seen virtually through telehealth and virtual health platforms, right? So this is what's happening. And this is how, where you mentioned that which historically, traditionally not were to the manner digital born or have a large purchase journey. These are some of the live examples of how digital initiation and adoption can happen in that particular area. Back to you.
Very rightly said, Jasrita. I think some of the statistics that you had put across, like 77% of people search online, is very true, and definitely pandemic has actually acted as a catalyst. Because if I remember around last year, a KPMG report very clearly said that this number was somewhere around 65 to 67, which is actually shot up by 10-15% post the pandemic happening.
Absolutely.
And also video content definitely is the one which is playing a very big role. And we'll be talking more about the telehealth part of it. Because
Correct.
I remember attending some of the Ministry of Health and Family Welfare meetings, white papers. And I do very well remember, because that time it was a bottleneck for them to initiate the telemedicine thing. And now it is actually, if you see, every hospital is doing it. And it is shot up increasingly. So now
and the government has also legitimized it. It's now there as a part of the Gazette. And the Ministry of Health and Family Welfare is actually saying this to all healthcare providers, saying that this should be the preferred medium for follow-up care. For follow-up care or for chronic care, telehealth, virtual health should be the preferred medium, So therefore, there is also a blessing and an impetus coming from government, which is much required.
Absolutely, absolutely. And a big transition being seen post-COVID. I'll just move
That's
to the
right.
next question to you that
Yeah.
so you have a little bit of it been answered, but how did or how have the healthcare brands leveraged digital medium during the ongoing pandemic?
Yeah. I think first of all of them had to think about whether you are government, whether you're private, public, private, whatever. You had to think about public interest service messaging. That was the first thing. So I think all healthcare providers, regardless of whether government or private, amped up their public service messaging in terms of social distancing, wearing masks, contact tracing, telling about the travel history, et cetera, et cetera. So I think that's one thing that they did for consumers and as a service to the nation. The second is, again, which is very important, patient engagement through Facebook Lives, through Instagram Lives, through online support group moderations, etc. Because let's not forget, when suddenly the country went into a lockdown, care for a lot of chronic patients was disrupted, So, and how do you disrupt suddenly the care for a dialysis patient? A dialysis patient needs that dialysis session. A patient who's undergoing chemotherapy needs that chemotherapy. And suddenly, if your hospital that you've been going to, let's say, all these years have been made into a COVID-only facility, which means it cannot take you anymore, then obviously you needed your healthcare provider to engage with you and allow the continuity of care to be maintained either through the digital mediums, virtual mediums, or to be able to route you to another facility, So all this patient engagement, allaying the fears, question answers, myth busters, wherever supply chains were disrupted for, drugs and consumables and medicines, for pharma, etc. All of that was done, patient engagement through social media channels, Facebook Lives, Instagram Lives, as I mentioned, virtual consult platforms, right? Because you had to mitigate the risk of infection. So many parts of the country were not only a lockdown, were under a curfew. And if you're in a red zone, what do you do if somebody is ill? So virtual consults platforms. I can talk about the group that I come from, that from the point of lockdown till now, we have done about 70,000 virtual consults. We've already sort of rendered. And a very important part, which we don't talk about much, and I feel very strongly about it, is most healthcare providers, certainly us, we've run mental health helplines, we've done webinars, because suddenly life was disrupted for everyone. The physical remnants of the disease everyone knows about. Every day we are following those figures: how many people died, how many people recovered, how many people crossed 1 billion, whatever. But there is no statistic on how many people are dealing with the mental health impact, the negative mental health impact of the pandemic. Students are, because they cannot no longer go out and play in the playground. Sports people are, because they cannot train. Housewives are, homemakers are, because their work has quadrupled. People like us are, who have to work, manage home and all of that. So therefore, we were running and are still running a mental health helpline, which is like 24/7 available all days of the week, all days of the year, and in which free, the advice is given by counselors and psychologists in 15 Indian languages. So I think this is what healthcare providers did to varying degree, and certainly us. I think social listening. Everybody had to listen into social on your pages, to consumer feedback, to complaints, etc., and had to be more agile in terms of your response. Like I said, Twitter at that point in time had become the go-to medium for everyone to say, what are the latest lockdown guidelines or unlock guidelines, and where can we go, what is open, what is not open, So therefore, with a captive audience there, healthcare could communicate to them, whatever they wanted in terms of public service. And last but not the least, again, very important, is also what healthcare did is celebrate the stories of hope. So while there are numbers that we read every day, but those numbers, those are numbers of gloom. And I'm not trying to, sort of take the gravity away from it, but the stories that we need to celebrate are stories of hope. So when an 86-year-old gets discharged from a hospital, or when a 90-year-old is able to beat COVID, so those stories of hope, which are made into a video, or, which we try and make them go viral, put it out on news platforms. So I think infusing this positivity and celebrating the healthcare workers, doctors, nurses as the cheerleaders, as the real heroes of the pandemic, and the stories of hope. These are some of the things which, healthcare has done in this pandemic.
Definitely, great. That was again very insightful. And I mean, actually, these are certain things that definitely we are experiencing when it comes to digital marketing. And also very insightfully, you told about healthcare, and you likely mentioned about the audiences, the demographics, and how we can actually get their experiences on board through videos, to different testimonials, because testimonials and all also work very well in healthcare. And people actually, I will not use the word sympathize, but very much empathize with the treatment they have received and how the things have happened there.
Correct.
So thank you so much. Thank you so much, Jasrita. Now I move next to Mr. Pranav. So hi, Pranav. You'll have to unmute your, yeah.
Hi, Rohit.
Hi, Pranav. Welcome again. So a brief introduction for Pranav. Mr. Pranav Desal is the Director, APAC, Brand Marketing Expansion, Fanisko. Mr. Pranav is currently associated, like I said, with Fanisko, a digital fan engagement and analytical company, driving digital fan engagement transformation for sports organizations. That's interesting. With augmented reality and gamification. Before Fanisko, Mr. Pranav led a US-based premium, that's again very exciting, motorcycle brand, CCW, as CEO and CMO, and built the brand and the entire operations in India from ground zero. Mr. Pranav possesses diverse industry background in automobile, engineering, energy, telecom, electronic, and textile, and functional exposure with a tenacious commitment to driving growth. In summary, if I say, he led startup, turned around poor performing mid-sized company and achieved astonishing results across automobile OEMs, two-wheeler and series, investment banking and manufacturing, marketing enthusiast, built the brands from ground zero, led business plan with top line target of 250 USD million and budget of $15 million, managed 190 plus team size, contributed in global strategies, raised US $15 million funds, built winning team, led change management, and managed board and stakeholders effectively. He also has to his kitty is he has traveled extensively with exposure to international assignments in China, Singapore, Sri Lanka, Bangladesh, Europe, to name few. So thank you very much, Pranav, to joining us. And now I'll be moving on to the questions that we have for you. So that number one question again starts with the branding and marketing strategy has to be looked into with the long-term perspective and also in the short-term perspective. Now the question is that how the pandemic has positioned digital as the most effective strategies in the marketing plan.
Yeah, in fact, Rohit, the pandemic has actually, compelled people to think through, introspect the strategies regarding the marketing and branding. Because, there is a common issue which we face earlier or we observe earlier. Moment we say digital, the obvious response come to us is we already have pages on social media. We already have Facebook, we already have Instagram. But then it was important to discuss that digital is not only social media. It's different perspective altogether. It should be looked into holistic way. And that's where the short-term and long-term perspective comes in the play. So as we know, branding is now the era is, we have seen multiple eras, like it was the production era, then product era, then sales era, then marketing era. And now we have come to the era which is experiential based marketing. It's no longer just a marketing where you do ATL, BTL activities, hoardings and prints and that's over. Digital has taken a significant space in your entire comprehensive plan of marketing. And so it's important that how do we create experience for the audience, whether it's a sports domain when we talk about fans, or when I was in automobile, then it was a customer who is actually taking inquiry. So let me share example from the bike, what we launched from the ground zero. as a brand. So it's important to map the entire customer journey or touch points, when the audience or consumer or any XYZ person is engaging with your brand and with the product. So it's important to lay down the point number 1 to the post-purchase behavior, and you map the entire process. And during this process, you need to identify which are the touch points are extremely important in the brand point of view, where the brand is actually speaking about the, its significance to the audience. And there on those touch points, we need to identify where the digital can play a role, which can enhance the experience. So for example, when somebody wants to buy a bike, so whatever communication we have put it across, whether it's a ATL, BTL, any ad, or even the social media. So the person who is expecting to buy a product or explore about the product, he or she will first of all come to a website. From there, he will try to locate the nearby dealer. There, he will try to go there and explore the products there. Moment the person enters the showroom, how the salespeople are treating him, how they are welcoming him, how they are showing and communicating the products as well as the specification. Then there is a process for registering yourselves to take a test drive. Then there is a negotiation and then you buy the bike. Then there is a question of financing arrangements from the bank or the insurance. Then your delivery of the bike will happen. After that, the person comes in with the first service, for during the free service to the service station. Again, the experience. So when you look at all these points, every point has experience for the consumer, for the brand. And so first of all, if somebody comes on my website, how is the experience on the website? Is the website is good enough to respond? Are you covering enough, the feature like chatbot or something which actually gives the immediate response to the queries what consumers are asking for, or technical questions? There are many other brands people come as a window shopper and try to understand your brand. So how do you respond the customer on website? Then when you enter the showroom, the guy enters the showroom, do you have any digital interface to capture all the information what he's talking about? One of the banks, when we were talking about tying up for the financing, vehicle financing, the only bank told us out of 5 banks when we had a meeting, they said, if you want to do a finance with us, we will complete the process in 15 minutes through our guy talking, standing with the iPad with his hand. 15 minutes assured process completion. And that's where the experience comes in the picture through digital way. So then if the person is taking the finance from that particular bank and he will get the satisfaction in 15 minutes, my brand will automatically get, weighted up. That, okay, this guy is delivering the promise what they're talking about. And of course, the social media plays important role. When we were in the promoting efforts, we spend 80% of our budget on social media. And so all the pages, again, the content is important, but then the engagement also is important. So gamification is an interesting area. Last year, the Flipkart registered 70% growth because of the gamification factor was added in their portal. So gamification also has become very important tool through digital. So coming back to the point, when we look at the long-term perspective, all these touch points, you need to focus on digital intervention, whether it's the bike servicing or the warranty periods. One of the times, if you remember, last year, the Ford ran the very aggressive campaign on downloading mobile app and getting your service estimate done. Because there was a perception that Ford is expensive car to be maintained compared to other brands. And that's what the Ford realized that, no, we need to remove this perception. So what did you do? They launched a mobile app. And through that, actually, you can see what is my estimated cost for servicing and vis-a-vis what has happened actually on the ground. And that digital intervention actually helped to bridge or rather kill that perception that the Ford is expensive car in terms of maintenance. So these are the touch points are very, very important. And that's where we tell people that don't just look at the short term, I have social media pages, so I'm done with the digital. Go beyond that. And that's where the experiential marketing plays a very, very important role. So Fanisko, when I talk about, we offer that element of experiential marketing by creating gamification zone. We had fantasy cricket. So you can predict ball to ball game when you are on the live match. So you register yourself, you predict the results. If you are very close to your results and score the points, then you win the prizes. And that is where the importance is, how do you engage fans or your customers, and so that your communication is very, very perfect. Yeah, right.
Okay. Thank you, Pranav. I think two, three very good points that you mentioned were like, one of them was that you are right that initially it used to be like just having a social media page used to be like, okay, that's the presence that we kind of have. I have one observation here, which I really want to share, is that recently what happened is there was one set of entrepreneurs whom I found they were actually still not there on social media or any of those handles. And post the pandemic, what has happened is they have also realized that, okay, now we need to be there on any of these kind of platforms. And these are the ones which we can actually use to build brand. So before that, they were mostly relying on flyers, brochures, or any other kind of offline activity, traditional part of activity. And now they have actually, I mean, accepting the fact that, okay, social media is something that we can look forward to, and we can actually start investing money, even at a small level. But they have started realizing that we will get those eyeballs now. Okay. So now coming to your next question, which is very much close to artificial intelligence. So the question is that how the role of AI transformed during the COVID-19 in India and across the globe, and has this transformation started, or we are yet to see this transformation happening, right?
Yeah, very valid and important question, Rohit. In fact, and if I take the clue from the first question again, that COVID has actually given the time to introspect everything. So initial couple of months, I would say 2 months during the lockdown, I mean, all of us were in panic. Nobody was knowing that what exactly has happened to us and what's going to be there in next couple of months, because even government was coming out every week something new and there. So when we were talking to our clients back then, they said, no, everything let's hold. We don't know what to do now. But from last 2-3 months, yes, there are interactions started. People have actually thought about that this is important thing about digital aspects, and also adding AI features or AI-based features to their products. Let me talk about sports itself. Now, the IPL is coming now, we know that, and it's because of pandemic has been shifted out of India. Now, look at the IPL itself. It's a seasonal game. Now, during the season, there is a huge hype on fans and your flags, and people are painting their faces and T-shirts and everything. It goes like, adrenaline rush to the highest level. But then after the game is over, then the fans or the sports franchisee or all these players, they go in vacuum till the time next season comes in. So the people realize that, are you going to put all the efforts again to restart that?
Pranav, you're there? Pranav, you're there?
Perhaps we can move on and come back to Pranav once.
Yeah, I think Pranav, some network issue from there. Pranav, you're there? Just let me just check him once. He's joined again.
Am I audible?
Yeah, you're audible, Pranav.
Yeah, there was sudden power cut, and so just UPS backup. Yeah, so I was talking. So this is the area where, in 360-degree perspective, now the fans actually can see the entire stadium. We have also initiated the process for dressing room experience with the players. So whatever happens in the dressing room before the match, what kind of engagement happens, that kind of thing also, because of 360-degree perspective, they can be part of that. We also discussing about the gymming session of players, so even the gymming session tour can be taken up and fan will be excited to join the session with the particular player. We also have gamings. So based on the games, if you achieve certain points and if you win this game, then you have a selfie possibility with the player. So you are sitting in Mumbai and the match is going into let's say in UAE. In the hotel itself, the fans 3D image can be portrayed with the player, and the player will take a selfie, and that will be sent back to the fan. So you can imagine the experience what the fan will have for the particular game. And during the lean period, we will run a lot of contests and quizzes and all this thing. The players will come on the mobile app and will start sharing the sessions on fitness, educating audience about the sports, addressing live sessions and answering their questions. So these are the aspects which will definitely help engaging fans, not only during the IPL's game which is happening, but also between IPL game when the time is lean particularly. Another angle is all of us would have, I'm sure, would have watched the game, the movie Moneyball. The Brad Pitt, when he actually they collect the data for the players which were not selected in the clubs. He identifies the strengths of these people through a data analyst and actually make a team which is there, and they predict the performance of this team based on working on their weaknesses. And they come out with the performance and that team becomes number one from nowhere. So now a lot of clubs are actually, we are discussing with them about the similar kind of approach, the data-driven things, and when the predictability is possible through AI approach, and that's where the team performance can be augmented. So these are the things now, because of COVID, the franchise owners or the players, and they are started thinking about it. How do we engage fans on a longer term basis? Because if you engage more fans, it is beneficial for franchisee also, because then they can get more sponsorship, because there is a wider reach and deeper reach for the audiences. So even the franchise now renegotiating the terms for sponsorship to increase the money for sponsorship. So these are the various angles which actually AI and this gamification, the predictive analysis and all this really help in the sports domain. And one of the areas is like just a beginning, Rohit, as you asked the question, is not even started in the full-fledged zone. It's just the beginning.
Great. And I think IPL Insight is really quite interesting because that's something that we all will look forward to. And like you said, that the virtual stadium being monitored and everything, and I think it's going to give us a far better experience than actually watching it live, right? Like today
Absolutely.
also, if we get into a lot of AI products or anything, I think it gives us a far better experience altogether. Yeah.
Absolutely, yeah. That is an important opportunity where the fans will be engaged in a much better way, for sure.
Right. Now we move to Barry. I'll just share my screen. So welcome again, Barry. Barry has joined us from London, and he's the founder and director of Next Gen Digital. So Barry is founder, and he's a London growth marketing. So I explained the Next Gen Digital is a London-based growth marketing consultancy that provides growth marketing services to startups and small businesses. So Barry is a 20 years experienced marketing veteran, and he has worked for industry leaders in various marketing capacities in addition to delivering marketing projects for the banking, hospitality, petrochemical verticals in India, the Middle East, and in the UK. So he was in Bangalore for a very long time. Correct me if I'm wrong, Barry.
Not for a very long time. I was in Bangalore for a couple of years, in the late 90s, actually. When Bangalore was a lot different than what it is today.
Great. And apart from multiple public speaking gigs to his credit, Barry also provides consulting and mentoring to startups to help them achieve their business goals. He's here to talk about his journey as a marketer and to share his view and insights on the topic that we'll be discussing. Yeah. So, question to you, Barry. How the brands have been able to use tech and show their human side during COVID-19 pandemic?
Well, okay. So once again, thanks, Rohit and the team at Beyond Imagination. Can you hear me? Sorry.
Yeah.
Yeah. Right. So the whole digital transformation and digital marketing and digital technology and then all that intertwined with COVID-19 these have been subjects that have been talked about for quite a while, especially in the last 6 months. So I'm gonna actually first I want to talk about how brands are embracing the human side and using technology to sort of impact their customer base and their fans in a very positive way. So we all know that the crisis, the COVID-19 crisis, hit global economies big time, right? Everyone's pretty much affected, and it's a threat to everyone. It's a threat to individuals. It's a threat to organizations. But a few organizations have stepped up to the challenge, and they're the ones that are essentially creating a legacy for themselves in these very trying times. Now, right here in the UK, we have organizations like the NHS and a lot of the top tier government organizations that are doing a really good job. But then one would say they're expected to do a good job because that's their role. I don't agree with it entirely, because there's always things that you can do beyond what your duties and responsibilities are. But I'm not going to address what the NHS and all those guys are doing. I want to address what other brands are doing. Brands like supermarkets, like Tesco's and Sainsbury's. These are the brands. They were the first people to respond during the pandemic. They were the first people to have their staff work extra to bring in new stock to make sure that their stores were their shelves are stocked with the necessities. They were the ones that had enough volunteers manning different stations and making sure that social distancing was being followed. And then there's these other brands. There's these other smaller companies. For instance, I don't know if you guys have heard of the company, a little known company called Leon. They're quite popular here, especially in London. They're a chain of small coffee shops, kind of like Starbucks, but a little bit smaller. And what they did was initially, as soon as the lockdown was announced, as soon as it was declared a pandemic, they said, we're going to give 50% discount on all meals to all NHS workers with an ID. Not only that, but their CEO kind of put together a consortium of restaurant suppliers and food suppliers, and they were kind of giving away free food to critical care workers within the NHS, right? Then there's another really small company called Brompton Bicycles. They rent bicycles to people in London. I don't know if they do it outside London, but they do it within London. They offered about 200 or 300 foldable bikes for free to NHS workers during the crisis, because the people were scared of taking public transportation. So they said, you know what, we're going to give you these bikes. Obviously, there was a qualification criteria because your boss or your supervisor had to recommend it, but they gave away those free bikes, no additional cost. And then you look at the slightly commercial side of it. If you've heard of this beer company called Brewdog, they're based in Scotland, and they're really, really good. They make a lot of really good beers for those of you guys that are beer drinkers out there. What they did was they said, well, people are not drinking as much. We're going to take our facilities, make a few modifications, and we're going to start manufacturing hand sanitizers, right? Because the hand sanitizers were very much needed. You would go to any shop, any supermarket, any pharmacy, and it was really hard to get hand sanitizers. So they started making those hand sanitizers, and it turned out to be a very practical solution to a genuine problem. And this kind of helped them build their trust and their loyalty, right? Even people that drank other beers kind of gravitated towards Brewdog because they felt a kind of kinship with them, and then you had other brands worldwide like Lego. Lego started giving away free toys to kids because they wanted them to stay home but still experience the beauty of childhood. Keeping safety in mind. Obviously, McDonald's addressed the issues of social distancing, and they actually told people why they're closing down their stores. And this is one thing that I think a lot of brands don't get. When something like this happens, when there's a pandemic, when there's even a situation that applies just to your brand or your organization, it's very important that you communicate so that people know what's going on. So these are brands that are coming to mind right away. I'm sure there's like thousands of brands that have done their job, done their bit. But at the end of the day, the fundamental principle that Gary Vaynerchuk, I don't know if you guys are familiar, or some of the listeners might be familiar with Gary Vaynerchuk. He talks about one fundamental principle to making sure that your business succeeds, and that is care, right? Brands that I've just mentioned are capitalizing on the current situation to bring in more ears and eyeballs to their business, and that's probably true. But at the heart of their goal to succeed is the fact that they actually care. And these are the brands that will come out of the situation, leaving a positive mark, or perhaps even build a legacy because they stepped.
Right. Point taken. And like you gave example of Lego and other brands and the Scottish beer brand. Similarly, we see that the same thing happening in India also, like for example, following social distancing or diversifying the product range from say making what do you call making deodorants or perfume to launching sanitizers. And also many of the automobile brands, especially interest Pranav, many of the automobile brands have also moved into either making the ventilators,
Yes,
or they have
yes.
actually moved into making products which are essentials for the COVID-19, right? So now I move to the next question, Barry.
Yeah.
What are the simple ways to transform the technology? How the use of technology can be transformed further? The micro misconception about digital transformation. Is there any kind of misconception that we have today regarding digital transformation? Have we understood what is this digital transformation, or we are still trying to Google and understand that what exactly it means? Because what I personally realize as a digital marketer is that one is accelerating it further, and some people kind of misconceive it kind of a thing as we do it today, maybe tomorrow we are just going to drop it further. Okay, so that's the kind of misconception people are having.
It's kind of like, is it a fad or is it here to stay? It's kind of like what people were saying about social media way back in 2009 and 2010. Because I remember when Facebook was nearing its peak, and Twitter was nearing its peak, and I was sat with a bunch of guys, and they were like, "Oh, this social media thing is just for kids. It's not going to catch on." And then here we are 10 years later, and it not only has it caught on, but it actually drives a lot of our businesses forward. The thing about social media, the thing about digital transformation, and it's a term that is recently it's been thrown around a lot, very loosely, especially now with the global, with the pandemic and all that. While most business leaders already understand that digital transformation is critical to a successful organization, a lot of them have different definitions of the term, right? So in today's environment, especially following whatever's happening post COVID and all that. Now, whether you are delivering a responsive customer experience, or whether you're launching a new product or service, or whether you're optimizing your operations, you need three things to succeed with your digital transformation initiatives. Right? You need the tools, you need the process, and you need the culture. Right? You need all these things to enable employees to to access and analyze incredible amounts of data and then act on it, and sort of put all those ingredients together. It's kind of like it's all these amazing ingredients being put together, and you're making an awesome recipe or something. Now, to be able to survive in this competitive business landscape and outshine your competition, you've got to be a business that's on the cusp of technology and innovation, right? But sadly, and this is I got this number, percentage. It's according to Bain and Company. Only 8% of global businesses that are currently pursuing digital transformation are getting positive results. Now, there's a caveat here. This is data that I got pre-COVID, in roughly in March. So I don't know what the latest stats are. I'm sure they must have increased. But as you know, as of February or early March, it was 8%, only 8%. That meant that over 90% of the global businesses out there are struggling to deliver on a technology-enabled business model, right? Now, the pandemic obviously has pushed brands to innovate, and you know, just like Jasrita mentioned, the real estate sector switched to 3D and VR tours. You know, I have a friend of mine who runs a VR company in Portugal, and he was doing fine for the last 2-3 years, but when I spoke with him a month ago, he said, "Well, we're getting a lot of interest, you know, for AR and VR apps." So that is very encouraging. You know, 3-4 years ago, when I was a little bit more involved in VR technologies, I did this presentation at the university, and I said, "Well, in future, you're going to be able to go to a concert without going to a con." And everyone was like, "Whoa, how is that possible?" And it is possible. And now more so than ever, because now you're going to be able to buy a ticket online, and whatever happens going forward, if the organizers are allowed to do actual live concerts, this will be an additional revenue, because you're going to be able to sell tickets to the live concert physically, and you're going to be able to sell tickets to the live concert virtually as well, right? So we see all these things either happening or about to happen, and we see small businesses have already started pushing, you know, more video content to influence prospects and customers. And this is something that I was doing for the last 2 years, but I've noticed that a lot more people are doing it right now, which is why the algorithm is a bit wonky, especially on platforms like LinkedIn and Instagram. Then we see healthcare providers, you know, like my local GP here, just right around the corner, was forced to roll out an online booking system. I remember, and people will be surprised, when I moved here in the summer of 2018, when I was logging into everything and when I was signing up to different services, I asked my local GP, "Hey guys, do you not have a website?" And they said, "Oh, we're working on it, and it's going to be up and running in the next 2 months." And then 2 months became 4 months, and 6 months, and 8 months. And then, you know, fast forward to March, April, within I think 3 weeks of the lockdown, or 2 weeks of the lockdown being announced, the site was up and running. So, like everyone's already acknowledged, the pandemic has really pushed brands and organizations to really step up their game. And all this is really encouraging, right? But the truth is, and I honestly think in most cases, digital transformation, even till date, is being used as a buzzword more than anything else. You don't really become a digitally savvy organization just by adding a chatbot to your website or by automating a certain process. You know, as counterintuitive as this may sound, the core of digital transformation is business transformation, right? So instead of executives asking a question like, "What technologies can I add to my business to make it more digital?" I think the question they should, you know, the question that executives should be asking is, "How can I make my business leaner using technology efficiently?" Right? So at the end of the day, digital transformation is about adopting a mindset, right? It's about adopting a mindset to use technology as part of your strategy to help your organization solve traditional problems. You know, it's about helping to make work easier and faster. It's about helping your employees to be more productive, and ultimately, it's about helping the brands and organizations deliver a more customer-centric approach, customer-centric experience to their customers.
Great. Thanks, Barry. So now I got the definition very clearly, right? That we have to move away from the fad and making it a fancy term kind of a thing. And we have to make sure that it actually helps the business and moves the business in the right manner so that we can benefit from the digital transformation, and which has actually taken a tenfold thing post the pandemic thing. Okay.
And most importantly, the mindset.
The mindset, exactly, which plays a very important role now, right? Now I move to Miss Sandhya. So I'll just hi Sandhya, welcome again. A small introduction. So Sandhya Kaushik is DGM Sales and Marketing, PSRI Hospital, which is located in Saket. Ms. Sandhya Kaushik brings with her more than 15 years of experience in building highly creative, unconventional communication action plans that turn vision into results. Ms. Sandhya has been shaping business strategy, driving brand solutions to achieve, exceed sales targets, to attain top and bottom line goals, and accelerating brands and leveraging marketing channels while inculcating high performance teams with a big and bold thinking. Ms. Sandhya Kaushik is DGM Sales and Marketing PSRI Saket, which is promoted by JK Group. She is innovative market. She is responsible for enhancing brand awareness through the implementation of innovative marketing plans through the company website, social media, print communication, and internal communication, and developed integrated sales and marketing plan designed to elevate PSRI's brand health pertaining to volume, market share, and brand objective of the hospital. So before PSRI, she was heading marketing for Max Healthcare flagship hospital, Max Sake, which we all know is a 450-bedded hospital, and Max Smart, which is 250-bedded hospital. Her feather in the cap includes the merit of launching and establishing new startups and brands from scratch, including Select City Hospital and Times Education. Ms. Sandhya has proactively launched 4 new hospitals, including Max Mohali, Max Bhatinda, Max Shalimar Bagh, and Max Dehradun. So while I'm reading it, also I'm experiencing it, that how big it is a task to launch such a great setups. So welcome, Sandhya. So I move to the questions that we have for you. How COVID-19 pandemic has accelerated the collaboration of digital platforms with physicians and patient care. So I think Barry also touched that point of GPs, which he spoke about, that GP was never having a website, and how things have moved that he immediately had a website post-COVID. So to you.
Thanks for the question, Rohit. And a lot of panelists have also spoken about how this COVID pandemic has pushed the digital transformation. And it's the same in the hospital as well. So it is for us, being a healthcare marketer, it is a blessing in disguise, because the kind of business which we have, where we don't look for customers come to us, the healthcare consumer comes to us. So that is why there was never a need or a push required for this. But this pandemic changed the whole situation, because nobody was prepared for it. And in fact, as other panelists suggested, this COVID-19 has worked as a catalyst, and it has actually forced the hospital to find venues, find different innovative ideas to engage with the patient digitally, especially when it comes to patient care. And this has led the digital platform companies to increase their scope and collaborate with the healthcare providers, especially the physicians and the other support staff at the hospital, to engage. And apparently these all digital platform, because of the help of these digital platform, healthcare physicians are doctors, the support staff, everyone has been able to benefit from this. And it's not that earlier people were not aware of this. It's just that there was no intent, there was no push required. It was in the process, and we all were pushing for it. So one fine day when COVID came, there was a need, and everybody was working on it quickly. And all these digital platforms, they created those options which were very, I would say, for doctor friendly, because this was the first challenge which we were facing. All the platform which we built for supporting our clinicians should be user friendly in terms of from doctor side as well as from the patient side. So basically, if I talk about the benefits, apart from just the teleconsult, the benefits were many. This enabled us to do a 24/7 virtual care of our patient. It also enabled my doctors or the clinicians basically to do a real-time feedback. It also simplified the visualization of data, which helped them to take the better decision. So all this helped a lot, and along this was more on the clinical part. And when it comes to the marketing part, or the things which were they doing pre-COVID, that has also helped. And the biggest support which the clinicians have received from these digital platforms is the flexibility. The flexibility to be available all the time, the flexibility to do all their marketing event or their learning programs as well. For example, all webinars or real-time video interactions, their CME. So this has helped a lot, and that's on the digital platform, and so it has also helped them to increase their reach. the reach to the states where the super specialty treatment was not available. I was going through, I guess last week there was a study in the newspaper about the availability of the super specialist in the states where there is a disease profile. For example, pediatric super specialists are required in Ranchi, but the number of pediatricians available in that city is very, very less. But because of these digital platforms, that demand and supply gap has been, I guess, flattened. Now, a person sitting in Ranchi can also get a consult done by a doctor sitting in Delhi. So these are some of the benefits which has helped basically uh, basically helped all the physicians, and that's about it from now. Over to Rohit.
Definitely. Thank you so much, Sandhya, because you're absolutely right. This is totally, there is a big transition that we see in healthcare setup primarily. And like you mentioned very clearly about the online appointments, that brings me to the next question that I have, which is what's your take on the increase in telehealth, which is recently started, and the remote monitoring programs by healthcare, considering the subject was, like you very well said, was always in a back burner. It was never in front, like Jasrita also mentioned about it, burner before the pandemic. And can you share some examples of the benefits, how it is benefiting and all?
So, yeah, yes, I agree with you, Rohit. Telehealth and remote monitoring program was very much there. In fact, when I joined healthcare industry almost 7, 8 years back, we were still working on it, working with GE, working with a lot of other digital platforms.
Correct.
But it just changed over the night. The reason behind it, because pre-COVID, we have technology was always available. Because it's not that within a week's time people have got the know-how. Technology was always there. The thing which was missing, or the biggest challenge was which we were facing, is the challenge to accept the openness, to
Exactly.
embrace the change. People always thought healthcare is that personal connect is required, this may not work. But this COVID-19 situation, which is a peculiar situation, nobody could think of a situation where people are not able to go to hospital. But this situation paved the way for telemedicine and remote monitoring program. And the when I talk about the benefits are immense. And the biggest benefit during this lockdown time or this COVID time is patient can get the diagnosis done, can get the teleconsultation done without even visiting the clinic or the hospital. Secondly, it also reduces the exposure of COVID-19 virus to the staff and the patient as well. And third and most important thing is this also decreases the burden of, but it also decreases the burden of the protective gear which is required. And the fourth benefit, which also I talked about, answered in my previous question, that it also gave the access to care, and that it also increased the access of the doctor to the remote areas as well. Now, a super specialist is available in Ranchi or in Bihar or in Jammu Kashmir also. So benefits are many. I feel the only challenge would be to see how it performs post COVID, and whether it becomes a new normal or not. That's the biggest challenge. Although I'm very positive about it, that people have started using this medium, and it should work the way it worked for Paytm at the time of monetization. It's
Exactly.
about developing the benefit, developing the practice.
Right. No, very rightly said, because one word that you used, acceptance. Acceptance is the biggest thing, because initially, if I talk about last year, we were not ready
Mhm.
to accept telemedicine as a technology in itself, right? We were more like, okay, who will consult the doctor online? Like we are
Mhm.
doing webinar, we were more keen in earlier times having seminars, and now we have moved to webinars, and we are much more happy. And Jasrita spoke about two of the industries. One was real estate and one was healthcare. So I would like to share one of the experiences. I met somebody in real estate, one of the founders of a real estate company, and he shared a very good insight with me. And the insight was, he told me, Rohit, I have 5 offices. I have in Bangalore, Pune, Chandigarh, Gurgaon, and Noida. Okay. And he said, if I have to do my team's review, so I used to fly to Bangalore. It used to be a 2-hour, 3-hour review that I used to conduct. And it used to cost me a day. It used to cost me 10 to 15,000 rupees. And my entire team in Gurgaon used to, I was not present that time, during that particular time. And I was there in Bangalore for a 2-hour meeting. Post pandemic, what happened is I realized that 2 hours meeting on Zoom or Cisco, I can do with my entire team. And after those 2 hours, I can spend time with my Gurgaon team, my Noida team. And in the evening, I can get back to my Pune team and I can do their reviews also. As a result, what he did is, during pandemic, he built his technology setup in real estate, number one. Number two, what he did is, he opened up 2 more offices and he got into co-working also. So it helped him in expansion. It helped him in saving money because of the travel, getting exhausted, okay, health again. And number 4 is that he actually spent the time with his team at the right time also. Okay, so that is the, telemedicine, the webinars, all these things that we are doing has actually led to a very productive and like Barry said, it has to result into business, right? Everything, every digital transformation that we are doing has to end up into business aspect, right? So without wasting much of time, we'll just move to Rajni. I'll just share the screen. Hi Rajni, welcome back. Welcome again.
Thank you, Rohit.
You're welcome. Okay, so about Ms. Rajni Abhijit, she's the business franchise head in Novartis Oncology. She heads the hematology franchising for Novartis Oncology in India. In her role, she has worked to make innovative pharma products reach to more patients in India. She has gained a wealth of diverse functional experience with oncology by working in marketing, market access, policy, commercial excellence, and alliance management for major companies like Novartis, Pfizer, and Glenmark. As India presents a unique opportunity for huge potential to add combined with challenges of affordability, Rajni has worked towards addressing these access challenges. At Novartis, they have successfully deployed many unique models like income-based pricing, patient assistance programs, patient access navigation, and partnerships with governments to achieve these goals. Rajni defines herself as a learner and is consistently curious to learn new things and acquire new competencies. She believes that COVID-19 has presented marketers with a huge opportunity to bring out the much needed transformation in the traditional marketing practices and redefine the game. So welcome Rajni. I'll just move to the questions for you. Now, what do you think is the scope for digital? How deep or how wide can we aim for India, especially in your sector wherein we are talking about oncology per se, which is in itself, we consider it an entire healthcare hospital, which has the maximum number of departments. So over to you, Rajni.
So thanks a lot, Rohit. And at the outset, I would like to thank Beyond Imagination for having me on this esteemed panel with you, Barry, Jasrita, Pranav, as well as Sandhya. And if I had to answer your question in one word, I could only say the scope is huge. Now, I would also say that, the digital piece that we are talking about, the marketing and the mediums that we are talking about today existed in the past as well. So there's nothing new that has come up. What has actually changed due to COVID is that the friction to adopt these new models has reduced significantly. Earlier, the need to adopt the digital models was something that was always questioned, that when we are already doing well with the traditional methodology, what is the need to change? I think that need was presented by COVID-19, and therefore the adoption has become much, much faster. Now, as we say for everything, for every habit, you need to do it for 21 days and then it becomes a part of you. I think in my mind, I don't think we are ever going back to the pre-COVID world because it's been more than 21 days. And I think we all have really adapted to this new normal. This is the new way of life. So maybe some things once the entire world is vaccinated and we are in a completely safe world, there will be some bit of going back to the old methodology for some traditionalists. But I think what this pandemic has shown us is that we can do things in a much faster, simpler way with digital. So I think that's what, again, comes down to the scope, what digital has offered. And if I had to give you some statistics, now India has the largest audience size for social media platforms. And before, even if I get into social media, if I look at the mobile penetration, the penetration of mobiles in India is more than healthcare. So even where there are no doctors available, people still have mobile and are using mobiles today. Okay, and within that, if we look at the usage of smartphones and of social media platforms, Facebook has 290 million users only in India. WhatsApp has 340 million users, and even Instagram has crossed 100 million. So, and at any point of time, if you go to YouTube, more than 10% of users on YouTube are Indian. So, you know, when you try to see all this digital transformation and try to correlate it back to India, I think there is tremendous acceptance of this digital technology in India as well. And if we have to really take this to the, take it back somewhere, I think even a prime minister always believed in the vision for digital and therefore the Digital India campaign. Now, COVID-19 has only provided the needed thrust. Now, going to marketing specifically through digital, and I would like to say that I keep telling this to our marketers as well, that digital is a medium while the fundamentals of marketing will still remain. It doesn't take away the fundamentals of marketing, and we need to remember that, but it has become the most preferred and the most relevant medium today. It offers the ability to go beyond boundaries of countries, age, qualification, races, and therefore it allows us to get a very large reach. At the same time, you know, there is a huge opportunity with digital to go very tailored as well. If you want to have something very selective and want to reach a particular customer profile only, that is also very much possible with digital. And if I had to link this back to the marketing principles, I think the core fundamentals of segmentation and targeting, which we used to learn about in our marketing days, I think they are something which have become, once again, come in the forefront with this digital marketing. And every time we are discussing about a digital campaign, what we are trying to very clearly analyze is what are we trying to do? What are we trying to achieve out of this? Which segment are we going to try to target? And what is the message that is becoming most relevant to that particular segment? So that degree of tailoring as well as customization and individualization is possible with digital. I think when I talk about digital, it is incomplete if I do not talk about data along with digital. And while Pranav touched about AI and the importance of it, I think digital also opens up a whole new world of possibilities with the data that it brings along. And what the marketers can do is definitely take much more informed decisions and choices with the data that comes in as to what's working and what's not working. So, you know, that's something where, you know, I feel much more confident of making decisions on. But needless to say, there is no merit in doing isolated digital initiatives. You need to develop a full ecosystem to support the full customer journey, and then only it can be the most impactful. So once again, to summarize, I think the scope is huge and there is a lot that can be achieved through digital in marketing.
Great, great. Thank you so much. We are actually getting so many questions from the users and we are so much short of time. Just one small question from you. As you are associated with the pharma, which is one of the most regulated industries right now, we all know, and how has the digital wave impacted your?
So one thing which I must say, being associated with pharma all my life, I think I've got to treasure it much more during this COVID time. Because if you see during this COVID, one of the things that we lack today is a drug or a vaccine to treat COVID. Otherwise, we have everything, right? We have the healthcare workers, we have everything that is needed to manage COVID except a drug or a vaccine. And that's where pharma comes into picture. So I think that's where I take true pride in being associated with the pharma segment. And when the lockdown started, the challenge that we had was we couldn't stop because the mortality associated with COVID was only 3%, whereas as you spoke about, I work for oncology, the mortality associated with many of the cancers is much higher. So the shop had to open. We had to service each and every request of the patient that was coming in because they need the drugs. And that's where I would like to also speak about a little the regulations that are associated in pharma marketing. I think they need to still come abreast with the pace of change that has happened in the overall marketing domain. And that's where some policy changes need to happen. And it is very much possible in pharma as well, because the way it has happened in banking, like my banking details are very like personal to me, between me and my banker. The same way it is possible in the pharma as well, where my healthcare details are very much between me and my healthcare provider. And that's where I think the entire country is moving towards. As a company, you know, or rather I must say the industry per se has adapted very well in terms of the business continuity during the pandemic as well as the new normal. So, you know, there are launches that have happened in pharma. There have been like great continuity of business that has happened in terms of servicing the patients that are needed to be given the drugs. And I think pharma has adapted very, very well. In long term, some regulation changes may help to take it further, but I think at this moment as well, we are pretty set to address the need and the challenge ahead of us.
Great, great. Thank you so much. Thank you, Rajni. And it's good to hear from pharma background, because we know how pharma has transitioned totally post-COVID also. And it was taking some steps initially, but post the pandemic, it has drastically changed, we know. And some of the brands I know are actually, they were doing good. They were getting, recognized in everything, but now it is again taken up to 4x, 5x of their revenue post the pandemic happened. So I'll just move to the questions. I'll keep it very limited because it was a 1-hour session that we had, but we, such insightful things that came across from every one of you. So thankful for that. And I'll just summarize with 2 questions. The first one I'll just move to. Just a minute. Just 1 minute. Yeah? Okay, so I move to the question that we have, and the question is for Jasrita. So Jasrita, considering what happened with Paytm in India yesterday, it had raised many questions on how brands like Google, Facebook are unilaterally controlling the digital ecosystem of the world. In such a competitive space, what do you suggest for an aspiring digital marketer to make one mark in the industry?
There are 2 questions actually in this question. One is relating to the controversy. So, you know, what's the take on that? And the other is that people who are coming up the curve, you know, what is the future for them? So there are actually 2 parts to the question. I'll try and address both very, very quickly because we are horribly short on time. See, the first part of the question, what do you do with these big tech giants is, governments are their growth has happened at such an alarming pace that governments could never keep pace with that. This is what has happened, you know. So you got to first understand the why of the problem before we come to the how to deal with it, right? But now governments around the world, civil societies themselves, and ethical hackers, ethical techies are waking up to this reality, and they're already raising the noise on making these platforms, holding these platforms more accountable. So that's one thing that's happening already. In India, I don't know if you're aware, because you asked this question from Indonesia, there's already a parliamentary panel which is being headed by a young, parliamentarian, which is calling Ajit Mohan, the head of Facebook India, and to come and say, because there has been data that is there in the public domain that they helped one of the parties win at the cost of all others, and that party is in power right now. So those kind of things are there. So I think that one is to holding them accountable, both from society, from technology, which is from within, and from the government. So that's once that happening. The second is, whenever we've seen in the history, if we look at economics and we study it, or marketplaces, whenever monopolistic or duopolistic kind of marketplace comes in any sector, that is the time when maximum disruption happens, and that is the time when innovation happens. So while these platforms maybe a decade or two ago were disruptors themselves, but today they stand at a risk of getting disrupted, their business models getting disrupted, with perhaps a more ethical and a more transparent sort of a platform, right? So those are two things which are, I had to say, for the first part of the question. The second part of the question is, anyone who's coming up and anyone who's watching, I'd like everyone to go today over the weekend, go and watch this documentary called The Social Dilemma. If you haven't watched it already, please go and watch it, because Social Dilemma features people who were the founding team members of Facebook, Instagram, Twitter, Google, etc., etc. So please do that, and that will give you a lot of idea, more than what any one of our speakers can say here. There are many search engines. You asked that, you said Google, Facebook, etc. There is a search engine called DuckDuckGo. Duck as in the duck. DuckDuckGo. If you use DuckDuckGo, it is a more secure search engine than Google, and surprise, surprise, it doesn't serve your search history like Google does, and like Bing does, and like Yahoo does, right? So those alternatives are there. It is up to us whether we are using those alternatives or we are going with the most popular one. Okay, so if we as users give more power and more usage and more consumption on the alternatives which are safer than these big tech giants, okay, then there is already an alternative, then it will become a viable and a feasible alternative, right? And last but not the least, there is the Data Security and Privacy Bill, which is coming up. There is a cookieless future, which we are looking at, that no longer cookies will be tracers. So all those remarketing, retargeting, all of those unethical things which were happening, also in digital marketing, will have to sort of cease. So that's my 2 bits to that. But do go and watch The Social Dilemma, all of you, please.
Definitely, we'll be watching that, and definitely I'm also waiting for a day when this cookieless time period comes, because it's somewhat very irritating. Some people will not agree to me. Barry, I don't know whether you will agree to that or not, because remarketing plays a very big role for us when it comes to increasing the business. But yes, I also know that remarketing in our setup, in healthcare setup and all, is not very much allowed.
It's not allowed. Yeah,
it's not allowed. Right? It's simple. No, you can't even run remarketing on Google. You can't even do double click by Google for healthcare. So that is like one thing that we have been, I won't say we have already accepted, but for other industries, it's not something that is there.
Yeah.
So moving to the last question. It's for Barry, and the question is, Barry, how organizations use growth marketing and performance-based marketing, especially after the pandemic happening, and how it has scaled up and led to the different level altogether?
Well, yeah, I think based on what everyone else said, we were talking about how social is impacted marketing. We were looking at remarketing. We were talking about remarketing just now. I think one of the problems with remarketing is there's no cap, and a lot of people don't know how to use it properly. So because I have experienced this a lot of times. I'll go to a website and I'll keep getting serve the same ads all the time, and it happens even after I've bought that product. So I think people don't understand the usage of there's caps that you can use. You can say, I want to cap it to specific times in a day, or I want to cap it overall to 5 times in a month, or I want to cap it to 10 times. What ends up happening is, advertisers tend to lose money on it because they don't know how to do it. But that's getting into the technical side of it. I think as a growth marketing consulting company, one advice that I like to give everyone is look at your data, look at your analytics, look at your performance, right? So back in the day, we used to, I'm talking about 20, 30 years ago, it was all about hope marketing. And when I say hope marketing, I mean, you would run an ad campaign in a newspaper or on TV and then just hope that people would watch your commercial. And it was very hard to quantify results. It wasn't like, you couldn't put a guy on a rooftop, and look at how many cars were whizzing by a billboard and say, okay, there's like 2,000 cars that pass by. That means 2,000 people watch the billboard. Or, going by that mean sort of assumption that there were 4 people within a household and they were watching, Saas Bhi Kabhi Bahu Thi at 8 p.m. or whatever time, and then assuming that many people watched your commercial. Where now it's way more complex and it's more data driven, right? So you can break down, you can do hyper targeting, you can, there's things called personas, and I highly recommend that everyone starts using buyer personas that will help you. It'll help you do a lot of things. One thing, it'll help you understand the buyer behavior of your prospect, and then it'll also help you sort of identify where the micro moments are. Google's got this thing called micro moments, and those are basically specific moments in time in the consumer's pre-buying history where he or she decides on how to act, whether it is I want to know more moment, or whether it is I want to go and see moment, or I want to go and buy a moment. I want to know moment is more like I want to research this particular product, find out more information about it. I want to go see is maybe I want to go window shopping. I want to actually see what it looks like. I want to get a YouTube video, whatever. And then the eventual is I want to go buy moment. That is when you go and physically buy that product or service. You need to sort of fit this into your buyer persona just so you can map that pre-customer journey, and then that will help you sort of identify how your persona or how your prospect is going to think and react. And this kind of, it helps in a lot of ways. For one thing, it'll help you save a lot of money and time, and more importantly, it's going to give the customer a more personalized approach, because at the end of the day, we don't want to be buying things that we don't want. We don't want to be targeted for things that we don't want to buy or we don't have an interest in. Right. So and the problem with this cookie thing is, again, people will just randomly see an ad, they'll click on it. They may not, in most probability, they're not interested in buying it, but they just saw a really nice ad and they clicked on it. But then, marketers on the other side of the table get all excited saying, wow, these guys are interested. Let me serve him as many ads as possible. And that's what having a buyer persona and having that data driven approach will help you optimize.
Great. Thank you so much, Barry, for answering that. And that's really insightful. And I end with this last question. And thank you so much, everybody. Thank you, Sandhya. Thank you, Barry. Thank you, Rajni. Thank you, Jasrita. Thank you, Pranav. Thank you very much, everyone, for this great webinar. And we are taking a lot of information from here for us. And thanks, Jasrita, especially to you for answering all the things on the live during the live chat thing, and really thankful to you for that. And that's called the actual digitalization, if I say that's the realistic digitalization. And
so when people were wondering when my screen is going off is when I was just furiously typing, the best form of multitasking. So truth be told.
Correct. Thank you so much, everyone, and all the viewers, thank you so much. And all the questions that you have, you can email us or you can WhatsApp us on the number that we have provided you, and we will be our panelists will be helping us in answering those questions, and we'll be getting back to you with those answers. And thank you again. I don't feel like keeping switching off the webinar, but I'll have to with the time constraints. So thank you so much, everyone, and looking forward to meet you guys again in person and online again. Okay. Thank you so much.
Thank you.
Thanks, everyone. And thanks, Beyond Imagination team, for organizing.
Thank you,
Thank you, Beyond Imagination. Right. Thank you, Rohit.
Thank you all.
Thanks. Bye-bye.